Surgical management of anterior lens luxation, normally we can say left eye OS by intracapsular cataract extraction method. Coming to the clinical case, it is a canine 3 years old female dog came for with a blurred vision, and it is having purulent discharge. It is dog weighing 17.4 kg. Then upon examination, it is impaired vision with purulent discharge from the both eyes, that is ocular unitus, since 1 month, and unilateral corneal opacity. We can see very clear cut unilateral opacity, and it is having purulent discharge. That means it is having glaucoma eye in case of left eye. Upon the next coming to the clinical diagnosis, the case by observation with indirect ophthalmoscope, it was revealed that it is having a clear cut opacity and also a normal STT value. Upon identification or indentation method of IOP checking, it's showing the reading 30.1 mmHg. It's diagnosed as slight glaucoma. And on the clinical another diagnostic equipment, we used radiograph. It is a thoracic lateral radiograph. It is showing normal. There is no metastatic lesions. In case of ultrasound, because whenever the anterior segment of the eye, that is cornea, is opacity, we can't see the internal organs, internal structures such as any lens or maybe vitreous chamber or retina or any detachment cases. Such cases we can go for the ocular B mode ultrasound. So here in the sonograms, it is showing very clear cut the lens will be luxated, and it is a clear cut indication of diagnosis of lens luxation in case of a bitch. Then coming to the procedure. Coming to the procedure, we can first surgical option by excision of the lens, luxated lens, with the help of surgical procedure that is called intracapsular cataract extraction. First, we have to fix the eyeball in the proper position under general anesthesia. In case of general anesthesia, we used total atropine sulfate, xylazine. In case of normal pre-anesthetic, and induction by propofol by maintenance with isoflurane anesthesia, volatile anesthesia. Then after proper aseptic surgery, the eyeball is properly fixed with sterile number 1 silk sutures. You can eyeball exposure, proper exposure. Then coming to the incision by the 2.8 mm keratome. Then later we can incision by corneal incision. Then once we can incision, we are immediately inject the viscoelastic material. Afterwards reball will be proper position. Then after, with help of the lens loop, we can remove the luxated lens. After removal of luxated lens, then we can proper suturing of the sutures with the help of 80 silk under the operating microscope. These are minimum 4 to 5 numbers of 80 silk sutures. These are non-absorbable suture material. We can remove after 11th or 12th day. Then this is the removal of luxated lens. Then later we given post-operatively very clear cut instruction to the owner. Post-operative management, very clear cut, we have to provide the Elizabethan collar for the neck collar. Then immediately we have to give the proper antibiotic eye drops with the help of gatiploxacin, and also NSAID eye drops we used, advised to owner fen. Morning and evening we have to clear cut, and also apply the ointment also. Jobra, it is antibiotic ointment. For necessarily you have to clean artificial tears also, we are advised for the proper post-operative management. Then later these are the references. Thank you.